topic is Obsessive Compulsive Disorder, or OCD. Obsessive Compulsive Disorder, or OCD, is a condition in which a person has repeated distressing thoughts or obsessions, feelings that they need to do specific things or compulsions. Most people with OCD have both obsessions and compulsions, but a person does not need to have both to be diagnosed with OCD. Everyone has thoughts that they cannot control. Many people also follow certain habits or rituals, but in OCD, these things happen very frequently and get in the way of normal life. OCD usually starts when a person is a child, teenager, or young adult. People with OCD has obsessions, compulsions, or both. Obsessions are repeated thoughts, mental images, or urges the person cannot control. They cause distress and might make the person feel upset, anxious, or disgusted. They are often not logical. For example, someone with OCD might worry a lot about germs or getting sick, worry that they or a loved one will get hurt or die, feel the urge to do something violent, sexual, or suicidal, even though they don't really want to do those things. Picture upsetting images in their mind, want things to look symmetrical or perfect, compulsions, also called rituals. These acts or behaviors the person feels they must do. They are often related to obsessions. The person feels like they need to do a specific thing or follow certain rules. Compulsions are not always visible to other people. For example, a person with OCD might wash your hands over and over, count or recite specific words in their head, do certain actions repeatedly or a specific number of times, repeatedly check things like whether they locked a door or turned off a stove, arrange things in a specific way or order. Different people have different obsessions and compulsions. OCD can make it hard for a person to do their normal activities and enjoy life. People might avoid certain places or situations, or it can get hard to get things done at school and work. There is not a specific test to diagnose OCD. It's usually based on the symptoms, specifically the types of obsessions or compulsions and how it may affect the person's life. Sometimes other mental health disorders can cause similar symptoms to OCD. OCD can be treated with cognitive behavioral therapy, or CBT. The person talks to a counselor or a psychotherapist about the things they do. Then they help the person to change how that person thinks about a particular situation and how to react to it. Therapy for OCD involves exposure and response prevention. The person works with a therapist to practice dealing with their obsessions and learning how to control the compulsions. It can take time to train the brain to change the way it responds. Some people with OCD are treated with medications that can be in addition to therapy. There are different medications that can be discussed with the psychiatrist or the doctor. Sometimes people with OCD have unwanted thoughts of harming themselves or others. Help is available. To speak with someone, call or text 988. Call the doctor or the nurse, an ambulance, or go to the emergency department. I hope this topic was helpful. Thank you.